It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. How do you know if a dog is dehydrated? What happens when a dog becomes dehydrated? Severely dehydrated dogs need immediate emergency veterinary care. Symptoms include vomiting and/or diarrhea, less energy, weakness, or difficulty standing. Just like us, dogs will gain and lose water throughout the day. They lose water by panting, breathing, urinating, defecating, and evaporating through their paws. They balance water loss by eating and drinking. When dogs lose more water than they take in, they become dehydrated, which decreases body fluids and blood flow. This decreases the amount of oxygen that organs and tissues receive. Dehydration also causes a loss of electrolytes, including sodium, chloride, and potassium, which have important functions in the body. Vomiting and diarrhea, for example, often cause a loss of electrolytes, while dogs with heat stroke or heat exhaustion often have higher than normal levels of these electrolytes. If left untreated, dehydration can lead to kidney and other organ failure and death. 1. How much water is it normal for my dog to drink? In general, healthy dogs need about 1 ounce of water per pound of body weight per day. If they experience fluid losses, such as vomiting or diarrhea, their water intake must increase to meet these demands. 2. Symptoms of dehydration in dogs. Symptoms of dehydration can be seen with as little as 5% fluid loss from the body. If your dog is dehydrated, you may notice some of the following signs. Decreased activity, weakness, difficulty standing. The eyes appear sunken. Dry nose. Dry and sticky gums. Thick saliva. Decreased skin elasticity. Loss of appetite. Vomiting. Decrease in energy. Panting. Tremble. Unconsciousness. In extreme cases, death. 3. How to check for dehydration in your dog. Gently pinch your dog's skin between his shoulders, lifting it about 1 inch or 2 from his body. When you release the skin, it should normally snap back into place right away. When dogs are dehydrated, the skin will slowly fall back into place or remain raised, just like you pinched it. Check the capillary refill time of your gums. Press the gum with your index finger until it turns white. Release your finger and watch how quickly the color returns to the gum. The gums of a hydrated dog will return to their normal color immediately, while those of a dehydrated dog will take up to 3 seconds to regain color. 4. Causes of dehydration in dogs. Dogs can become dehydrated quickly from continuous vomiting and/or diarrhea, from being active in extremely hot weather, or from having a fever. Dogs with diabetes can become dehydrated when they have too much sugar in their blood, causing them to urinate a lot. Increased panting, which is how dogs control their body temperature when they are too hot, can also lead to dehydration. Dehydration, if left untreated, can lead to serious conditions including kidney failure, abnormal heart rhythms, and even death. Dogs that experience mild dehydration often recover quickly once they have drunk enough water. When dogs become severely dehydrated, drinking water will often not be enough to rehydrate them and stabilize their condition. Your veterinarian will determine the cause of dehydration and administer the necessary medications along with fluid therapy to relieve symptoms and help you recover. 5. What to do if your dog is dehydrated. You can offer a slightly dehydrated dog small sips of water or ice chips to lick every few minutes. Too much water too quickly could cause vomiting and worsen dehydration. Once your veterinarian has evaluated your dog, they will make recommendations on the best way to rehydrate. In mild cases, the veterinarian may recommend Pedialyte or another electrolyte solution or rice water. Rice water helps, especially in cases of dogs that experience frequent diarrhea, as it helps firm up loose stools. For moderate dehydration, your veterinarian may choose to treat dehydration with fluid therapy under the skin, also known as subcutaneous fluids. When administered under the skin, the liquid is slowly absorbed over several hours. If your dog continues to vomit, has diarrhea, appears weak, unresponsive, or displays other concerning symptoms, contact your veterinarian immediately. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.